Welcome back, listeners and viewers. Dr. Sean here. Now that I have my first research short out of the way, I will include a link to that video on this slide when I upload it to YouTube. There's something else I would really want to talk about, and it's the concept of sleep. It's something that we all do, but some may find it more difficult to do it with maximum effect. Sleep is not just about clocking the hours, but more importantly, it's about the quality and the effects of our sleep cycle. Let's start. Before I start with today's research short on sleep, I'd recommend you head over to the United States National Institute of Neurological Disorders and Stroke website. It's called the NINDS. And they have a reference guide on there on a few key concepts and foundational information about brain sleep, which I highly recommend. You can read further on the anatomy of sleep, the stages of sleep and its mechanism, how much sleep you need to get, dreaming and sleep tracking, what are the roles of genes and neurotransmitters in sleep, as well as some tips on a good night's sleep. You can either pause my video, head over there, have a bit of a read, watch my video finish. I will include this reference at the end of my final slide with the link, so you could track back and go and look at it afterwards. So the research short for today is from Zheng et al., who did a study called Sleep Patterns and Risk of Chronic Disease as measured by long-term monitoring with commercial wearable devices in the All of Us research program. Full text is available in Nature Medicine. So some of the key concepts and key words discussed in this paper include sleep health, commercial wearable devices such as Fitbits, smartwatches, deep sleep, sleep duration, chronic disease, rapid eye movement, also known as REM sleep, hypertension, obesity, mental health disorders such as general anxiety disorder, GAD, and depression, to name a few. This study, published in the journal Nature Medicine, explores how different sleep patterns are linked to the risk of developing chronic diseases. To do this, researchers used long-term data from commercial wearable devices like Fitbits to track sleep and other health metrics. This data was then collected to electronic health records from the All of Us research program, a large national health initiative in the US. The goal of the study is to address the limitations of earlier research by providing more detailed, long-term and accurate sleep data, unlike previous studies that may have relied on self-reporting or short-term data. The study uses continuous objective measurements of sleep over an extended period of time to better understand how sleep impacts health. Poor sleep health is associated with a higher risk of death from any cause and the development of various chronic conditions. Previous research on this topic often used cross-sectional data, which looks at information from one specific point in time, or polysomnograms, which are detailed sleep studies conducted in a lab or in a controlled environment. However, these methods have limitations, such as providing only a snapshot of sleep patterns and involving a smaller number of participants. The study aims to overcome these limitations by using data from Fitbit devices, which monitor sleep over longer periods of time, and linking this data to patient electronic health records. And by doing so, the study seeks to better understand how different sleep patterns are related to the development of chronic disease over time. Data were collected from 6,785 participants, with the average age being about 50 years. These participants were monitored on an average period of about 4.5 years. The study focused on analyzing various aspects of sleep, including different sleep stages such as REM and deep sleep, the duration of sleep, and the regularity of sleep patterns. The researchers then examined how these sleep characteristics were related to various chronic diseases. This was done by using two methodology approaches, which were phenome-wide association studies, which looked at a wide range of diseases in relation to specific factors, and then targeted assessments which focus on specific diseases and conditions. So what did the researchers actually find during the study? And this is just taken from the research paper. It's just a heat map showing the incident phenotypes on the vertical axis across the various categories of sleep that they were looking at on the horizontal axis. Essentially, anything that is in bold numbers, as well as in the darker colors, red, darker orange, light orange, or brown, if you want to call it that. That means a positive association was found between those particular phenotypes on the vertical axis across these various categories of the sleep measure they were looking at. So in detail, the researchers found a clinically and statistically significant relationship between sleep quantity, sleep quality, and regularity and the onset of important chronic diseases, even after accounting for daily activities such as step counts and exercise. So in terms of sleep stages, in REM, rapid eye movement sleep, and deep sleep, there is an inverse relationship with atrial fibrillation, which means that more REM or deep sleep is linked to a lower likelihood of developing this type of heart condition. Atrial fibrillation is a type of irregular heartbeat that can lead to various heart-related complications. Okay, in terms of sleep irregularity, greater irregularity in sleep patterns, such as inconsistent bedtimes and inconsistent wake-up times, is associated with higher chances of developing obesity, which is excess body weight. It's also associated with higher levels of hyperlipidemia, that is high levels of fats in the blood, also with higher levels of hypertension, which is high blood pressure, and when looking at mental health factors, also associated with major depressive disorder, which is a severe form of depression, as well as heightened levels and higher levels of anxiety disorder, which is called generalized anxiety disorder. And this is characterized by excessive worry and anxiety. So these were the key findings that were highlighted on this heat map, but there is quite a few others as well, and that is explained in a lot more detail in the research paper. So what else did the researchers find? They found that there is a J shape. If you look at the shape of that graph, it's almost like a J. So it starts with the, at the lower end, and then it sort of like bottoms out on the baseline one, and then it goes up again. So they found a J-shaped relationship between the average amount of sleep per day and conditions like hypertension, which is high blood pressure, depression, as well as anxiety. This means that both when you get consistently a short amount of sleep per sleep cycle over a period of time, say under 6 hours, for example, but also if you get, over 9 hours of sleep or longer over a period of time, so very long sleep cycles, there's an association with a higher risk of developing these conditions. And the moderate amount of sleep, and I would say moderate would be anything between 6 hours, and 8 hours. So flat bottom of the bottom part of the J, that's probably the sweet spot that you want to be in to minimize your risk for developing some of these conditions. And this is over obviously a long period of time. We're not talking about 6 hours of sleep or less in a short over a short period of time. We're talking about repeated consistently sleeping too much or sleeping too little. But I'm not going to include people that actually need to sleep due to brain disorders or due to other medical conditions. This is obviously for healthy, fit individuals and the risk of developing certain conditions, chronic conditions. They also found that there are significant differences in sleep duration based on various demographic factors, such as sex, race, level of education, smoking habits, and alcohol consumption. This means that these factors influence how much sleep people typically get. And if those factors are detrimental and it lessens the amount of sleep you get per cycle over a long period of time, then it makes you more prone to people, more prone for developing possibly some of these conditions to your health in the long run. So what can we conclude from this particular research study? Well, the study is the largest ever conducted using sleep data that has been objectively measured through wearable devices like Fitbits. It emphasizes how crucial sleep quantity, i.e. how much sleep you get, sleep quality, i.e. how restful your sleep is, and sleep regularity, i.e. how consistent your sleep patterns are in the development of chronic diseases. The findings of this extensive study highlight the significant role that sleep patterns play in long-term health. The use of data from commercial wearables offers valuable insights that could help shape evidence-based guidelines for healthy sleeping habits. Well, looking ahead, further research should focus on including more diverse populations to ensure that these findings can be applied more broadly to different groups of people and can be representative of people in society as a whole. For those interested in delving deeper into the nitty-gritty of this research paper, and believe me, there's a lot of data and information to peruse, I've included the article link in the video description and on the slide. It's open access and thus available to anyone. Additionally, I have included the United States NINDS's website with a link to Brain Basics Understanding Sleep, which I mentioned earlier in this talk, and as well as some useful videos on why sleep is good practice and routine is so important. I highly recommend watching Professor Matt's TED Talk called Sleep is Your Superpower, and another video from the prof called How to Improve Your Sleep. Both of these videos do touch on some of the key health points in general, but also what was mentioned in this journal article short that I presented. Sleep quality is indeed nature's best medicine, contributing positively to brain and body health. So if you have any questions, feel free to comment below. If you like my content, please do like and subscribe, as this will help my channel. And I thank you for your time and support. Until next time, bye for now.